Hi there, everyone. I am Kenneth Kumakech, and yes, you're most welcome to Kent Medical Center podcast channel. This is episode 1, and I'm so happy to be here. I'm so happy to talk to you all today, and I hope you and I will be able to learn something new. Our topic today, we're going to talk about diabetes. Diabetes is this very common disease which is disturbing millions of people. And some people they know, some people they don't know that they have diabetes. So we're going to discuss and see the definition, the types and signs, symptoms, and and how we can prevent this disease. Well, we're going to ask ourselves, what is diabetes? Well, diabetes have so many different definitions, but this is a disease that occurs when your blood glucose, also called blood sugar, is too high. Blood glucose is our main source of energy, and it comes from the food we eat. Well, that means what we eat plays a big role for our health. Let's talk about insulin, which is a hormone made by the pancreas. And insulin helps glucose in the food get into our cells to be used for energy. But sometimes our body does not, make enough or insulin at all, or does not use insulin well. Glucose then stay in our blood and doesn't reach our cells. Over time, having too much glucose in your blood can cause health problems. Although diabetes has no cure, we can take steps to manage our diabetes and stay healthy. Well, this is very true. And we're going to look at the different types of diabetes. Let's first start, to talk about, because this is most common types of diabetes, which is type 1 and type 2. And the other type is gestational diabetes. Let's try to look at, take a closer look at type 1 diabetes. So type 1 diabetes means our body does not make insulin. Our immune system attacks and destroy the cells in our pancreas that makes insulin. This is normally common in children and young adults. Okay. With this, the diabetes needs to take insulin every day. If you have this type 1 diabetes, you need to take insulin each and every day to stay alive. Wow, this is serious. Now let's talk about type 2 diabetes. Our body does not make or use insulin well. We can develop type 2 diabetes at any age, but mostly middle age. This is where we get this diabetes. Okay, and we're going to talk about how common is this diabetes. If you look to according to the record of 2015, talk about almost 30.3 million people in the United States of America had diabetes. More than 1 in 4 of them didn't know that they had diabetes. This disease, and it affects 1 in 4 people over the age of 65 years old. And let's ask ourselves what health problems can people with diabetes develop? And the first thing is heart attack. Heart disease, stroke. So with diabetes, you're most likely to have kidney disease, and eye problem. You'll be not seeing well, blurry vision, and dental disease also. Most common people with diabetes. And, we talk about nerve damage, and food problems. So these are some of the most common, disease that will come along if you have diabetes. And let's talk about the signs and symptoms. How do I know that I have diabetes? How do I know someone have diabetes in my family or my friends or whatever? Okay, we take a look at this. The first sign is urine. You pee a lot, especially at night. Okay, although this sign doesn't normally show, but there will be a lot of urination. You pee a lot, especially at night, and most of the time you'll be very thirsty. You want to take water each and every time, and you lose weight without even trying to lose weight. And we talk about other things like blurry vision. Not be able to see and a lot. Okay, and you'll be having numb and tingling of hands and feet, and your skin will be really, really very dry. Okay, these are the some signs and symptoms of diabetes. Let's look at now. If I have diabetes, my family have someone in my family have diabetes, one of my loved ones, my friends, whatever, have diabetes. What is the treatment for this? Okay, this diabetes is also called diabetes mellitus. Controlling blood sugar through diet. We can control our blood sugar through diet, what we eat, okay, what we take in our body. It really matters a lot because it plays a good role in our health. Also, the other treatment, we have oral medication or insulin is a main treatment. Okay, we talk about regular screening. For complication is also required. If you have diabetes, make sure the person is eating enough, eating a good diet, giving oral medication or insulin, the treatment, and also screening. Okay, so it's required. Okay, now other treatment is I'm going to talk about most especially for the type 2 diabetes. The treatment includes like diet, exercise, medication, and insulin therapy. In type 2 diabetes, treatment aims at maintaining normal blood sugar level through regular monitoring, insulin therapy, diet, and exercise. Pre-diabetes, the process from pre-diabetes to type 2 diabetes is inevitable. You cannot stop this. With lifestyle changes, weight loss, and medication, it's possible to bring blood. Let's talk about gestational, diabetes. So treatment for this includes strategies include daily blood sugar monitoring, and healthy diet, exercise, and monitoring the body. If blood sugar is too high, okay. Ladies and gentlemen, I'm so happy that we've been able to talk about this. But the most important thing, we'll talk about many of these in episode 2. And I hope you've learned something and how we can get to know someone have diabetes. I have diabetes. We need to go screen, and how we can avoid these. The signs and symptoms and the treatment. Thank you so much.